Welcome everyone to one of my favorite topics. Today we're talking about PCOS with the PCOS Diva. So welcome to the Integrative Fertility Masterclass. We've got wonderful speakers in this full day event that we've got here. And Amy and I are super excited today to have Amy Medling, the PCOS Diva. We've got a lot of Amy's on this Masterclass day. So we're really excited to have Amy Medling here of the PCOS Diva. She's going to be talking about reclaiming your fertility. And if you have not met Amy before, Amy is a certified health coach. She often hears from women with PCOS, polycystic ovarian syndrome, who are frustrated and have lost all hope when the only solution their doctors offer is to lose weight, take a pill, and live with their symptoms. In response to that, Amy has developed a proven protocol of supplements, diet, and lifestyle program that offers women tools to help gain control of their PCOS and regain their fertility, femininity, health, and happiness. We are super excited to have Amy Medling here today. Amy, welcome, and thank you for joining us.
Oh, thank you. Thrilled to be here.
Awesome. So, Amy Raup and I had one question that we wanted to start off when we interview everybody on this. And the first one was, what moves you about this topic and why do you feel so passionate about educating women about fertility, their hormones, and in your case, PCOS?
As early as age 14, I wrestled with a lot of common PCOS symptoms. My mom dealt with this, my grandmother dealt with this, and it felt like it was sort of my genetic fate. And one day in college, I found myself sitting in this cold exam room, scared and confused, really feeling lousy, not having had a period in months and months, not understanding why. The doctor looked at me in the eye and told me that they'd have to jump through hoops one day to get me pregnant. And she just renewed my prescription for the pill and sent me on my way. And in that moment, I really felt very helpless and hopeless. I did, however, have 2 sons with the help of fertility drugs. And after the birth of my second son, and this happens, I think, with a lot of women with PCOS, after the birth of a child, their symptoms kind of exacerbate. And I remember my husband coming through the door one day after work, and I was like on the couch and just felt way too old to feel, be way too young to feel so old. And I just knew that my doctors, they could only offer me metformin and the pill, and there just had to be another way because I just didn't tolerate those pharmaceutical drugs. And kind of to make a long story short, I spent a lot of time kind of looking for solutions on my own. And I changed my diet and lifestyle, and really most importantly, my mindset. I started taking care of myself, and my husband started noticing this shift and declared me a diva. And it was, at first I was kind of offended until I realized that in order to be my best and give my best to my family, I had to be a diva. And this, after kind of following this lifestyle, I ended up becoming pregnant without any fertility treatments at age 37. And I ended up having a little girl. And I think that having this daughter who may indeed inherit my PCOS genes, in fact, 50% of women who have a mom with PCOS have PCOS. And I think, having this daughter really, I wanted her to know that PCOS isn't this negative thing that I once thought it was, sitting in that college exam room. But it's an opportunity to live life like a diva. So that's really my motivation, to help women with PCOS take control of their symptoms and empower themselves to thrive with PCOS.
That's beautiful. I love it. I think that's such a powerful story and something that all the women out there who are dealing with PCOS would really connect with and hopefully gain motivation from, right?
Yeah, it's absolutely in your control. And there's so much you can do. And I think lifestyle needs to be the first line therapy. And you can, instead of some of these pharmaceuticals that are just kind of a Band-Aid on the issues.
Absolutely. So, on that note, PCOS is such a
not even kind of totally.
Yeah. So on that note, PCOS is such a super common, and if not the most common, one of the top common female endocrine issues. Why do you think women with PCOS don't get the information and care that they really need?
That's a good question. Yeah, it's the number one cause of female infertility, and 50% of women are undiagnosed. So that's a real issue. I think there's several reasons. First of all, I think that a lot of women may not express or tell their doctors the symptoms that they're experiencing, because they can be somewhat embarrassing. A lot of us with PCOS experience kind of male pattern hair loss, as well as hirsutism and hair growth where you really don't want it. So acne, so it's like this whole array of symptoms, and you might go to a dermatologist for the acne, or you might go to an endocrinologist because you're having some thyroid issues. And so I feel like sometimes these doctors aren't communicating, and they're treating the symptoms rather than the underlying problem of PCOS. So I think that's one issue. I think another issue is that there's a lot of doctors that just aren't really educated about PCOS, although that I do think that in the last couple of years that's starting to come around. But I think that's why it's so important for events like this to educate women so that they can advocate for themselves and ask to be screened for PCOS at their next doctor's appointment.
I was just feeding off of that. What would be some of the labs that you'd urge women to get? So say besides like a transvaginal, because not every ovary is going to look polycystic upon examination. What are some of the common lab tests that they could get done?
Yes, so I actually have a free resource. I call it the PCOS 101 guide, and it's available on my site. And I list a whole array of lab tests to ask for. But certainly, you should have your blood glucose and A1C tested, because at the root of PCOS is insulin resistance. So you kind of want to see, are you having blood sugar issues and insulin resistance? Also, elevated levels of androgens are a telltale sign. It's actually one of the diagnostic criteria for PCOS. So you definitely want your total testosterone, free testosterone. I think it's really important to have your luteinizing hormone and FSH tested. The LH often is elevated in women with PCOS, particularly thin women with PCOS. So that's really important. And I also think a complete thyroid panel. So many women with PCOS are suffering from hypothyroidism and even autoimmune Hashimoto's. So really critical. And then I think some vitamins. Vitamin D can be like just really chronically low in women with PCOS, and that can add to fertility issues, as well as B12. If you've been on birth control, or if your doctor's been prescribed metformin in the past, both can deplete B12, and that also low B12 is a factor in infertility. And I'm probably just off the top of my head sort of scratched the surface. Certainly you should have a lipid profile. A lot of women with PCOS have elevated triglycerides and issues with cholesterol. But certainly, download that guide, and really, maybe I should talk a little bit about diagnostic criteria.
Yeah, well, and what I wanted to mention too, that I think gets overlooked, at least I see a lot of, is the, the range versus the functional range of these hormones, right? And so what girls should be looking for, because they could say, oh, well, my TSH is normal, right? And it's a 4, or my vitamin D is fine and it's 40, or testosterone, So your list, I'm assuming, has the ranges that it should be.
Right.
Yeah. Okay.
Yeah.
I mean, I don't know if want to spend that much time going into what everything should look like, but just that for all you guys out there, that you should be aware of what's considered normal versus what's functional.
Yeah, and that's part of advocating for yourself. And I really recommend that you get a binder and request your labs. And you can, they can print them out for you right there at the office, and keep them in a binder so that you can, you know what's going on with your body, and you don't just sort of rely on your doctor, kind of looking through his charts and saying, yeah, this is what your TSH is. I mean, you really need to take control of this whole process.
Absolutely. Yeah.
Extremely empowering to do so.
Outside of diet and exercise and lifestyle changes, what else would you add to that list that would kind of be at the top of the list that patients should be doing to help be their own advocate and to control and manage their own PCOS?
Well, I mean, certainly outside of making sure that you're reducing those insulin levels, that's really important. And that really comes with diet and lifestyle. Talking about supplements, there's some really helpful supplements that can help women with PCOS. I also think stress reduction is so key. And prioritizing sleep. I think that so many women with PCOS do not get enough sleep. And we're on our iPhones and iPads, and we're up late, like with all of this screen time and stimulation, and we have to have downtime and unplug and really just get some sleep. It just can make a huge difference in insulin levels too.
And what about the role, like you touched upon it, but stress levels, but, I just think generally the emotional balance, what role do you see that playing, and how much do you advocate for your clients to, meditate or have a journal practice, things like that?
Yeah. I mean, all of that is really, it's so important in that mindset piece. I find that so many women with PCOS struggle with self-love. And the core of my PCOS Diva message is that you have to love yourself where you are in the moment, despite the acne, despite the hair loss, despite the infertility. And it's from that place that you can start making positive choices for yourself. I think so many of us, go on diets, or we're killing ourselves at the gym from a place of kind of punishing ourselves or willing our bodies into submission. And I think to make that shift of nurturing and nourishing, and being kind and forgiving to yourself is a huge positive shift for so many women with PCOS. And it's very easy to, I think, health taking really tender, loving care of me. So I think, that's a huge shift. And I think the other shift, and I kind of mentioned it in my story, how at age 18, I was told that they would have to jump through hoops one day to get me pregnant. And I hear from, I think I was saying like 8 out of 10 women who kind of put their bio on my Jumpstart program mention the same thing, that some doctor along the line told them that they were basically infertile, or that they would never get pregnant, or it'd be very difficult to get pregnant. And I think they've carried that story with them throughout their lives, to a point where some women now are in their 40s, and I think they took that as their truth, and that this would never happen for them based on one person telling them that, based on really faulty theory. I think the large majority of women with PCOS can get pregnant. And it's really important to change that story for yourself.
How do you work with women to do that? I mean, that's a big thing that I work with as well. And so you just have them kind of tune into that inner dialogue and get them to start changing the conversation some.
Yeah, and I think we've talked about this, Amy. It's kind of having that fertility mindset, and rather than saying, I'm infertile, which is so definitive, right?
Broken.
that,
Sorry.
yeah, it's, I'm, maybe I'm fertility challenged, but, I can do this, and turning it into the positive. And I think also on my site, I have lots of success stories. And I think that it's really empowering to see other women in your situation that have faced the same, messages, and be able, and that's really encouraging as well.
Absolutely.
Yeah, it's such a important piece. This piece of getting rid of that negative talk, all the negative information that others have told you. Because as you said, you start to believe that that's your truth, that's your reality, and this is the only way. And we've all heard those stories over and over. And it really starts with the Western medical profession, what your doctors have told you, what your OBGYN has told you, whether you were 18 or 25 or 35, when you walk in and get that information, and they're telling you, well, this is definitively the way it's going to be, and it's negative, then you start to believe it. So there's such a big barrier of trying to go against those negative thoughts and that negative talk. And you had mentioned, prior to starting the interview, how, doctors are just misleading and giving so much misinformation to their patients. You want to talk just a little bit more about that?
Yeah. So I was just talking to a PCOS diva who is, really working to get pregnant. She's doing my online program right now. And she had a question because her doctor told her that she basically had two options. She could go on metformin, or she could go on metformin and pay $10,000 for his, IVF fertility program. And to me, that's like jumping off of a cliff before, you've I can't think of the right analogy, but it's just crazy.
You know if the plane's going to crash, or something, right?
Yeah. No, there's just so much you can do before you get to the point where you're, plunking down $10,000 for IVF. Right. That's not really even, that's not guaranteed. And it begins with like the mindset shifts and the lifestyle changes. And I think the whole concept of PCOS diva and being a diva, I think that sometimes when women can let go of the trying to get pregnant and just start taking care of themselves and optimizing their health, which really ideally, and women with PCOS, they need to focus on optimizing their health. I say 6 months at least before you really are trying to get pregnant, by getting yourself in the healthiest place that you can be, because that's only going to help with your pregnancy success and the health of your baby. So just by kind of letting that all go and just focusing on extreme self-care can help in so many ways, before you have to take some extreme measures to get yourself pregnant.
Well, and even still, say that woman did wind up needing IVF, you'd still want her in the best health possible going.
Absolutely.
Because quality of uterine lining, all of that, and her response to the hormones, right? So all of that is so important. And I think that's, someone said to me, one thing that they wish their doctors would do less of is almost as if IVF's a guarantee, right? Oh, well, just do IVF and you'll get pregnant. And that's not always the case, Still, I think no matter what, we need to prepare. If that's your course, then you still need to be as balanced hormonally and as healthy mentally, emotionally, physically as you possibly can be. And that's often, there's a big misconception there too. Well, I'll just do IVF and it'll, I'll be fixed, and that's not the case at all.
Yeah, it's that Band-Aid approach. And really, if you can get yourself into a healthy place, which is what I did, after my my boys were born, but now my whole family benefits because as a mom, I know how to cook healthy, and and I'm teaching them how to take care of themselves. So, and especially my daughter. So hopefully she doesn't end up with PCOS, so she can kind of stave off those epigenetics. But it's not just that immediate reward. You got to look at it long term.
It's so important to take that long-term approach, but it's so hard for these women and these couples to do that because they're so focused on getting pregnant now, versus taking a step back and saying, well, if I just give myself, right. And if I give myself 6 months versus 2 months, or 9 months, the outcome is going to be so much greater at that point.
Mm-hmm.
And one thing I always say too is, especially women who are worried about their age, that adopting this healthy lifestyle actually will help you push back the aging process. So those eggs, that egg quality, your whole internal environment is actually younger than it was, 6 months ago. And there's a lot of science to support that, right? I mean, epigenetics and, we know so much more about cellular aging and how we can affect it. So, that's a push that I always encourage women to realize. And I always say, it's not just about you getting pregnant, right? It's the health of your pregnancy, it's the health of the baby, and then it's the health of the home you bring that baby into, which is so important, I'm sure to all of us. So,
and
go ahead.
And I just wanted to add to that too, that women with PCOS, I don't think our biological clocks tick at the same rate. It's beginning to show in studies that women with PCOS may actually be fertile longer. Women with PCOS actually may begin life with more eggs than women without PCOS. Right. This was shown in a study in Sweden, and that we actually are, because a lot of us aren't ovulating every month, we have a larger reserve as we enter our late 30s, early 40s, more balanced, androgens lessen, and cycles return. And I think that women with PCOS can get both seen that as well in your practices.
And all women, right? I do think, it's all about that optimizing your health, and that you should be able to get pregnant in your 40s. I mean, that's the subtitle to my book. So obviously, I forget, natural ways to improve your fertility so you can get pregnant now and into your 40s, especially with PCOS. You always see that they have a higher ovarian reserve than most everyone else. So we know we have a lot of eggs to work with, which is great. Speaking of, what's, say, your number one supplement recommendation then for PCOS girls? Patients, clients, women, divas.
So, I think that every woman with PCOS needs to have her vitamin D level checked, and to make sure she optimizes her vitamin D. I think that's really important. I also think that high quality fish oil is essential. It helps on so many different levels. And you can't just take flaxseed or flaxseed oil because women with PCOS don't convert that ALA into DHA, which is so important for women with PCOS. So high quality fish oil. And then I believe that many women with PCOS, I call it overfed and undernourished, and I just think that our bodies can kind of optimize the nutrients that they need to. So I think a good multi with a folate, because I think a lot of us have the MTHFR mutation, and you want to find something without folic acid. But beyond that, I think that the combination myo-inositol, dechiro-inositol is so helpful for women of all ages, not just those that are trying to conceive, helps on lots of different levels. There's a couple brands that I like by Theralogics, and then Designs for Health has a product called Sensitol that's good as well.
It's awesome.
Yeah, so I think that it really helps with your cycles. It helps with egg quality, insulin, androgens. I mean, it's like a really big buck, and there's been studies that show that that is as effective as metformin. So, you know, if your doctor has prescribed you metformin, maybe you can kind of stave that off and give you know, one of these combo inositols a try as well. And berberine too. I mean, I think berberine, you got to be kind of careful because you know, you probably don't want to be taking that like if you get pregnant,
Right.
but that also has been shown to be as effective as metformin. And, you know, insulin helps with androgens, acne, if you have acne issues. So, you know, I think that also N-acetylcysteine is great for women with PCOS and can help on many levels as well. I think I do want to make one note because I don't think a lot of people know that there is a link between PCOS and non-alcoholic fatty liver disorder. So if you do have PCOS, you definitely want to have you know, your liver health checked and advocate for that, because a lot of doctors won't do that in a, you know, typical screening.
Yeah, those are some great helpful tips, and certainly those supplements are things that I'm sure we all use frequently, but I know that many women out there are not familiar with at least all of them. So it's great to have that information.
Yeah, and the other thing that I was going to mention too, I think a lot of women, you know, go online to websites like mine and, you know, get information and kind of, you know, self-prescribe their supplements. And there's a lot of talk about Vitex. Helpful
Let's talk about Vitex. Yeah.
For women with PCOS, and for someone like me who always had elevated LH, Vitex can increase LH, which, you know, has really made my PCOS worse. So that didn't really work for me. And I think I just want to kind of put up a little warning sign for Vitex. I don't know what your thoughts are.
How many girls are on it? Yeah. Well, they'll be like, well, I'm also taking Vitex because I heard it's good for progesterone, or I heard it's good for ovulation. And, you know, Mark and I are herbalists, and we're trained differently. We don't use herbs in not how we're trained. We're trained to use them in a formulation, and that there's synergistic effects. And, you know, Vitex is that's not one that I typically recommend people to take unless there's very specific situations.
Yeah,
I don't recommend.
I get scared with Vitex because of that same reason that you both have mentioned. So many people read about using it online to help with fertility and all sorts of other things that they just come in already on it, or they ask me, can I go on it? You know, and I've actually very rarely used Vitex because I find that it causes more issues long-term than it does good. And I think, you know, I'm really happy you brought that up. I mean, I see it with all sorts of patients, but especially with PCOS patients where everyone wants to go on the magic Vitex pill, and it, you know, I don't think it's magic at all.
Same. I don't either. And it can be, you know, as you said, just much more disruptive than helpful. And so, you know, it's about educating yourself. And also, you know, I like the point that you brought up earlier, Amy, of just this sense of getting yourself back, right? Treating yourself like a diva so that you feel your best, you know, and letting your fertility come as an extension of that versus I'm going to take these 18 supplements that, you know, Mark, Amy, and Amy told me I need to take, you know, and not focusing on overall, like taking care of themselves. I mean, I'm working on the next book, and I have a piece that I keep repeating to everyone, but it's like, I could tell you what to eat. I could tell you when to meditate and what supplements to take. But until you actually think that you're worthy of having thriving health or fertility, none of it's going to make that much of a difference. Like, I need you to step into your shoes, tune into your body, have body awareness, right? You know, so to be aware of that, because we all see it in our clinic. You know, they come in with a shopping bag full of vitamins, and half of them are crappy quality, so they're not even absorbing them anyway. And then they have digestive issues, so they're really not absorbing them, you know. But to really tune into your body and treat yourself like you are worthy of having thriving health.
Mm-hmm.
It's my
and I think it's same goes with weight loss.
Yeah.
That weight loss is just the byproduct of bringing your body back into balance, and it's the same with fertility. It's really the ultimate goal is the bringing your body back into balance, mind, body, spirit.
Yeah, agreed.
Yeah, the thing I take away from everything you've said, Amy, is really like, for me, the PCOS, the diva way, if you will, is this way of tuning back into your body and reclaiming yourself, your femininity, and trusting yourself and loving yourself, so that everything else that you're going to do, right, all the supplements, lifestyle, exercise, whatever it is going to be, is really going to be effective for you.
Mm-hmm.
Yeah, and I think for me, PCOS was such a wake-up call. It was really a sign that things were out of balance, and I think that a lot of women with chronic health issues kind of go through the Elizabeth Kubler-Ross's stages of grief, and you have bargaining, and, denial, and anger, and hopefully at some point you come to this place of acceptance, and even beyond to gratitude that I'm thankful that I had PCOS, because I just turned 45, and I feel so much more vibrant than I did when I was 30 on the couch, not being able to get off when I had these little babies. And it's because of the PCOS that I've, am being a diva and making sure that I, do what I need to take care of myself.
And spreading the message you have, which is wonderful and so needed.
Yeah. Well,
that's great.
Amy, we both want to thank you so much for joining us today. I loved what you had to say. I love your message. I think really sharing that message with everyone out there, and hopefully they take it to heart and really can take this as a piece to move forward and start to really trust themselves and love themselves and love their PCOS and appreciate the gifts that it's given them and the opportunities it's given them moving forward in life. If people want to reach out to you, they can do so by reaching out to you through your website at thepcosdiva.com. And I think you've got a free gift for everyone listening as well, right?
Yes. I have the PCOS Diva 101 guide, and that's available at pcosdiva.com/hope. And I also have a brand new smoothie recipe guide.
Ooh, awesome.
And I think that smoothies are a great way for women with PCOS to kind of start off their day. So many women are, eating, gosh, what did I hear the other day, that this woman eats a Pop-Tart every day for breakfast. So, it's, I know. So for someone who, isn't used to eating kind of a healthy breakfast, but still wants something a little sweet, I think smoothies are a great way to go. So you can see I have Almond Joy, a recipe. I have one for chocolate covered pomegranate smoothie. And that's available at pcosdiva.com/smoothie. And I also have a podcast. Both of you have been guests on my podcast. I think I'm up to almost 60 guests. So if you're really looking for education about PCOS, check out my podcast on iTunes. I think it's a great place to become empowered.
That's great.
I love it.
We're going to
thank you so much.
Yeah,
so good.
Have links for everything as part of this interview, so you guys should be able to just click on those and take you to everything that Amy has to offer. She's got wonderful resources. Thank you so much for giving us a little bit of your time and being here with us today.
Oh, it's been my pleasure. Thank you.
Thank you.
All right, everyone. Well, thank you for joining us on this interview of the Integrative Fertility Masterclass. We've got several others for you to enjoy today. And then at the end of our day today, we've got a live Q&A, so stay tuned for that, and hopefully you join us with your wonderful questions then. Thank you so much. Have a wonderful day.
Here we go.